All right. Good morning. Oh, that was sudden. Yeah. Yeah. Thanks for coming in. My name is Joel Keene. I'm with Continuant, Director of Products and Innovation over there. Just a little history. I've been in the Microsoft UC space going on 18 years, pretty quick here. So back from the OCS days, that whole business. Um, Kind of an interesting, full disclosure on where we are today. Put this agenda and conversation together back in November, right, with a pretty set standard of what we're going to go through. And then in January, I moved over to higher ed, right? So I actually oversee our higher ed team. And that's all I've been focused on. And then Microsoft has these big announcements in March, right? So we're going to go through a lot of it. There's going to be some depth that I probably won't get to on some of the newer things, but I'd like to take you through that stuff, right? And just kind of touch on it. But we are going to talk through everything that I established up front, right? So everything that you kind of signed up for or expecting to hear, hopefully you're going to hear it today, and then maybe a little bit more. And we're going to address it really this way. So we're going to break it up into 4 parts. So those first four here, really the things that we talked about up front, right? The thing that we put the agenda together around. And then part 5 is really going to be that new component, right? A lot of it, of course, is going to be AI. As many times as we don't want to hear it, we're going to hear it. So just sit tight for that. And then we'll have some takeaways, right, that you take back to your customer base. We have some timings and stuff on this. Let's not pay too much attention to that, right? We'll get through it as we get through it. All right. Let's start with why now, right? Why actually pay attention to what Microsoft is doing with healthcare and some of the changes that they're making. All right. This first one is a pretty big deal just from, even the takeaways that we had from the keynote today, right? People are adopting AI. They're jumping in. They're going to use Copilot or whatever they're going to grab a hold of, and leadership's going to tell them to go do something with it. And they're going to pilot something, and it's going to be a very specific niche case, and then it's going to fall on the floor. It'll just kind of sit on the shelf for the longest time. So what's interesting about that is the healthcare space is really doing that at over twice the adoption rate as most other industries. All right, so it's something to be attentive to and to really start to grapple with so that we're not letting those industries, healthcare in particular, kind of go rogue, right? Then we take advantage of the technologies that are put in front of them. From a timing perspective, July 1st, if you haven't been paying attention to Microsoft licensing models are changing. You're going to see an increase, particularly in those frontline worker licenses. Healthcare, frontline workers are everywhere, right? And, especially from our perspective, we have been pushing a lot of the organizations that we work with into that frontline licensing model, really take advantage of that and be specific with optimizing your costs. Now that's going to change a little bit. So it's one of those things you really want to go back and talk to your Microsoft representatives about, make sure that the customers that you're working with are doing that as well. So that you're not missing that deadline and seeing that increase at the organization. Okay. And then 26, really Microsoft's focused on this being the big critical year. You could say they say that every year about something. This year it's about healthcare and the way that they're putting that together. We'll talk about these a little bit, but Copilot Health, Dragon Copilot, and then the Diagnostics Orchestrator. So if you're not familiar with those things, we'll touch on those a little bit later. Okay. So let's start where everybody knows that we should start. And that's going to be that compliance component, right? Every one of the solutions that we saw earlier was really focused around that. Healthcare is no different. I think the biggest thing to call out here is it's not HIPAA compliant by default, right? So can it be? Absolutely, right? You need to put all the right things in place. But out of the box, you've got some work to do before you actually get to a position where you're HIPAA compliant. So these first things are very standard. One is BAA, the Business Associate Agreement. It is standard language. It doesn't change. It's an agreement with Microsoft effectively on how you are going to operate to stay within those compliance standards. And then the next point is focusing on your licensing, right? You are going to need security entitlements, right? And compliance entitlements. As long as you're paying attention to licensing, you are probably aware that not everything is included with every tier. So when you're really looking at the way that that needs to be built out, we're calling out, right, E3 with compliance add-ons or using your E5 for all encompassing. But don't forget about your frontline workers, right? Do you need to bolt on compliance there, and what does that look like? Okay. Configuring pure purview and DLP, it's everything that we talked about earlier. So I'm not going to beat on that too much, other than obviously we've got PII that we're having to deal with, health information. You're connecting back into various EHRs and things like that. So you need to be very aware of how the information is being stored and transported, right? And the logging and retention. You want to make sure that you're setting aside your 6-year allocation for storage, and then paying attention to retention policies that you're setting in Purview to accommodate that. And then some of the other stuff you're going to want to look at is alerting as well, right? So looking at Sentinel for your SIEM and make sure that nothing's escaping what you're actually trying to accomplish there. A lot of this is going to come down to making sure that you're doing thorough testing, and we'll touch on that again later. But anytime you're actually rolling out any of these, compliance policies, not enough to put them in place. You really need to actually very thoroughly test those use cases. Otherwise, that's where you start to get in trouble, right? Hey, it should do these things, or hey, we feel like it does these things. It's not so much even just the technology; it's the things that, again, touched on in the keynote. It's the people, right? So, are you hindering the way that people are operating? Because if you are, they are going to find a workaround. And that workaround is usually non-compliant and very unmanaged. So those are the places where a lot of these organizations will get in trouble, is kind of skipping these steps, but not necessarily skipping just the technology aspects, but making sure that there's adoption behind it. One of those components, zero trust, right? Everybody's been talking about that lately. I participate in something called they're security exchanges, but they are organizational meetings where we sit around and kind of talk about different aspects of security in the enterprise environment. Trust is a word that is thrown around very differently, kind of depending on the context of the conversation. But what makes sense in all aspects of it is we talk about zero trust. And that is, it doesn't matter what it is, right? You can't just allow something because you know it's good, or because the CEO is a great guy and is usually on top of his game, or your um, uh, director over nursing really, has her processes down and has the organization locked in. You are using a bunch of different devices. You do have to manage identities. All of this is common sense. Doesn't specifically apply to healthcare, but please don't skip it. MFA on everything. This SMS thing really any industry, you kind of want to get rid of. Everybody's aware that SMS has got its vulnerabilities that have been identified, right? So SIM swapping, I would say if you're doing it at home for your own stuff, it's probably not that big of an issue. Somebody's going to have to pull your device and mess with it. But in an organization where you have tons of devices everywhere and the incentive to actually attack is much greater, want to get away from that, right? And so leverage specific MFA, and that's whether you're using a different provider, whether you're using Microsoft. Make sure that it's SMS free. Conditional access policy is kind of a no-brainer also. So really, we focus a lot from our position very much on devices and the way that devices interact. But then you get into identities and all those things as well. It's kind of a beast and it gets overlooked. A lot of times we leave things on by default and we don't go back and adjust to what those environmental standards and requirements are. So you need to spend a lot of time actually understanding what needs to happen. So the discovery and outcomes of any of these, the discovery, where you are, and the required outcome is going to drive the way that you put your conditional access policies in place. This is new and very beneficial in the healthcare space. So shared devices. We see it in manufacturing a little bit too, but healthcare, Swapping devices all the time, right? Big shift into mobility over the last couple of years. iPhones, iPads, whatever, Android devices. But now there's a QR code with a pen, so you can actually sign in that way and actually swap out devices rather quickly, rather than getting into the whole, okay, we need to sign out of an identity and sign back in, which was always a hassle. Or you end up with the shared account workarounds, right? So again, you need to be able to facilitate the way that the end users want to operate, or you're going to get in a lot of trouble because they're going to figure out a way around it, right? And then sensitivity labels. I think we're all familiar with, excuse me, how sensitivity labels work. But effect, oops, excuse me. But effectively, the big deal is really trying to um, identify health information, right, and block it out. Sorry, this was very distracting. So you want to make sure that your sensitivity labels are applied. As we get into it, just remember those actually follow the information, even if they egress the environment. So, social security numbers, patient information, any of those records that you need to keep blocked actually travel with the data when they leave the environment. Right. The things that we really focus on when we're talking to any healthcare facilities are really these three big groups. Very heavily impacted, obviously, by the technology that we put in front of them. So physicians and clinicians, right? Those are the ones. You see him, he's got the lab coat, right? So it's always the doctor in the lab coat with the stethoscope kind of thing. Uh, we have a tendency to see them as the VIPs in that area. To a certain degree, that's true. And we could also go like everybody's, a really big component of a very large team. But the big things that happen here are leveraging Dragon Copilot. And like I said, we'll get into that in a little bit, but for doing documentation support, right? So actually taking notes on diagnostics, being able to translate that in a way that makes sense, using the EHR connectors to go natively into Epic and Oracle Health. All right. So those are a real big deal. The biggest EHRs that are out there today. What you don't want to hear from any of the physicians or any of the facilities are, hey, we don't want to make a change to all of our patient records, our databases, all that stuff. We're saying, hey, you don't have to do that. We're actually going to put a layer on top of that so you can make most out of that environment. And some things like virtual visits, and we'll talk a little bit about telehealth in a minute, what it can't do. And then file sharing, some other things you'd expect. Nurses, though, really make or break the way that you're actually putting the technology into play. If you work in these environments, you definitely know that. And then the other thing is they are generally the hardest worked employees in the environment, right? So a couple of things that really come into play here. One is going back to that Dragon Copilot. Dragon Copilot ultimately is it's an ambient conversational AI, and it actually pulls a lot of information in and does translation to actually post information in really one of three big models. So one being physicians, one being nursing, and one being radiology. Each of those have a certain kind of workflow that differs from the other, right? So physicians, of course, focusing on diagnosis, the actual patient record. Nurses dealing with the daily operations and the workflows and what you're dealing with from a customer perspective. They usually have very structured workflows, right, and processes around filling out paperwork and documentation. And that Dragon Copilot is actually designed to be able to help facilitate building those out. So what happens is the nurse really just needs to check it and approve it, right? Make adjustments. You're talking about things that save an awful lot of time for these guys. And then your frontline and support staff, right? So really just kind of that next wing of that nursing aspect. But the people that are sitting up front and making it happen again day to day. This frontline hub is a component that really is focused on making things as simple as possible for your frontline workers to interact with the rest of the environment. Okay, going back to that QR code for shared devices, and then focusing on what the licensing looks like for those users, right? So these are staff that are usually in that frontline tier, right? That F1 and F3. But then going back to what we're focusing on from that compliance perspective, do you want to bump them into that F5 compliance add-on, or do we actually need to be restrictive on what their behaviors or activities look like? Okay. The other thing that's actually built into, excuse me, to the platform, so the Dragon Copilot and those components are hospital templates, right? So they're available across pretty much every one of the automation components in the Microsoft stack. So it really allows you to roll some of this stuff out very quickly and deploy it in a way that's easy to digest and consume. And then once they're out, they're of course customizable, right? So it's not like you're locked into any given template. You can make adjustments as needed for the actual organization. All right. Devices. So let's talk about this for just a minute. Um, Teams rooms and certified devices, right? We're really just kind of treating them like any other endpoint to a certain extent. Okay. In the healthcare space, we actually leverage these more in conference rooms than really anything else. It has a lot to do with consultative meetings, right? Even sitting out with patients or remote caregivers or physicians. And then kind of the rest of it, you have the actual technology behind it, right? MTRs are not new to us specifically, right? But when you're putting them in an environment, we have this thing where, hey, do those become kind of that telehealth component? And to a certain degree, you can leverage it for telehealth, and I'll touch on that in a second. And then the other component is really your virtual visits. So uh, Teams Premium, if you haven't messed with it, is a really great licensing add-on. Lobby controls being a big deal when you're dealing with patient care. And then custom branding is good for everybody. They want to know who they're calling into. And then those meeting recaps are a big deal. So um, those are all included with that Teams Premium license. So if you're familiar with it, almost a requirement for these kinds of scenarios. Virtual appointments are built in to that EHR connector, right? Excuse me. So if you want to schedule a virtual appointment, you can do it right there through the HR. You don't actually have to run out and manage two different platforms for scheduling. So, and then the DLP note, which actually does testing of those DLP policies. Okay. Last thing is kind of touch on Teams Phone in a healthcare environment. Big fan of Teams Phone, been doing it for a long time. Teams Phone in healthcare is a little bit unique, right? We have some very large organizations and systems that are actually moving over to everything Teams, including the phones. Um, Mostly, we don't see that though in particularly in actual clinic and hospital spaces, right? So we see it in ambulatory clinics, we see it in administrative, we see that virtually everywhere for Teams Phone, where we see common area phones. So think nurse stations, right? Call rooms, that sort of thing. We actually see a lot more organizations going to not necessarily away from Teams, but using SIP phones through SIP Gateway, because the phones tend to be a lot more responsive, right, and reactive. In those cases, they're used to wanting to be able to have some flexibility on the phone, right, and you can do that with an actual SIP Gateway phone, and you're restricted from Teams from doing a ton of customization. So a heavy consideration when you're going in to talk to a facility about that is make sure that you understand what their phone needs are, right? And then we still see a ton of environments that are mixed environments, a lot of UCAS or multicast, right? So, um, organizations that need survivability will put survivable branch appliance in place. That works just fine. But you're still stuck on Teams Phone. You have a lot of organizations that don't want to put full reliance on that and want to have a full on-prem PBX. So putting something in place and then tying it back with maybe a direct routing trunk or using a direct routing as a service provider, that sort of thing, right? So we have a tendency to talk to our healthcare organizations as cloud first and not cloud only, right? So really to try and position the way that they're moving their technology stack. But almost every one of them needs some sort of facility locally, right? Especially the like I said, the larger hospitals. Okay. And then the other thing to be considerate of, and I'm sure everybody's aware of this, Teams does not have compliance-based recording, right? So we can record calls, absolutely, but we don't have compliance recording, so you're going to need a bolt-on for that. Good. No, not at nursing stations. Nursing stations are almost always just phones. Yeah, and we'll use, whatever PolyEdge or Yealink or, something that sits out there that's SIP gateway compliant. Both, right? And that just comes down to a conversation around what the facility of the room is supposed to be. Um, the healthcare specific is consultative analysis, right? So when excuse me, when you have a physician that's sitting with a patient and they need to consult with an expert that's in another remote location, they'll we typically have room set up for that. Um, oh, interesting. Um, yeah, I mean, doctor to doctor is really no different than any other conversation. Where it gets a little bit weird, and one of the things you need to pay attention to is when you're putting these policies in place, right? Like your DLP or you're configuring your purview. What that actually does with a lot of your external users is it starts to impact the functionality, right? So think about, all right, well, I can have a video call, but now they need me to send them a file or something. Now you got to go somewhere else to do that, right? You can't do that. Well, depending on your configuration, or you got to build out an exception to allow me to send a file through an external part of this meeting. So um, again, it's not like you can make telehealth work through Teams, and there are a lot of facilities that do some level of it. But you need to be really attentive to what that behavior is going to look like because it does get constrained by the way that the policies are built out. Right. Okay, the new cool stuff. We did all the platform conversation. This is all the new stuff that's been out. So Copilot and Teams. This is not new to anybody in this room, or shouldn't be anyway, right? Even if you're not in this room, nobody can go anywhere without Microsoft shoving Copilot at you somewhere, right? It's in your Outlook, it's on your Windows. There's 80 different versions of Copilot in everyday life, right? Um, but your meeting summaries, your shift coordination, shift scheduling, and your coordination of your nursing staff and that sort of thing plays into that to a certain degree. Dragon Copilot is substantially different. It launched last March of 25, so it's been out for a year. It's been pretty widely adopted, right? So 100,000 um, clinicians on it daily, leveraging it. It's across 9 countries or something like that. But all that is to say, it does multiple languages, right? So that's a big deal. It's based off of Nuance. So if you've heard of Nuance, right? Microsoft picked them up a few years back, several years back. This one, and they are a speech recognition company. And this is one of the resultant applications of that purchase is leveraging ambient conversation to be able to facilitate these workflows specifically. There's a couple of things here. One is, and it's going to be true with Copilot Health too. They don't use it to train models, right? It's their own model. The information is locked in. Um, it's, it's, I don't want to say it's risk free, but it's as close to risk free as anybody can believe something to be risk free. And Copilot Health is really the consumer side of all that. And so what Copilot Health is really being able to tie all of your medical records together, bring those forward. Wearables, if you have your devices and you want to tie into those and connect into those. So the idea is to be able to give consumers as patients a very clear picture of what their health actually looks like or where they might see concerns. Again, yeah. But, sure. Yeah. It is, yeah, it operates like a separate app. Yeah. So yeah, there's a whole marketplace on it. Yeah. Um, and yeah, you control all of that. Yeah. Where so wearables like your Apple Watch or yeah, one of those rings. Well, the intent is really to be anything that can communicate back to be able to tie those together. You can do that today. It's all consumer based though. Yeah. There, yes. No, good question. So some of it, yes, some of it is going back to Microsoft and obtaining documentation and kind of showing what their policies and procedures look like. Yeah, mostly. So that BAA that I was talking about earlier, that's the business associate agreement. That is establishing, hey, here is how we're going to operate, and that's on the customer side. That's not on Microsoft side. Microsoft is very clear in the language about what you can and cannot do and how you can do certain things. And that's all loaded like it's a big document. It's just a contract, it's a legal contract, right? So foundationally, everything is really based off of that. And then we really stack on from there. So again, like the Copilot Health thing, I mean, the problem is you're never going to get around somebody who's very, very, very skeptical, right, as to what somebody's doing with the data. Um, I mean, all you can do is kind of point them at it and then bring in Microsoft to also have the conversation and corroborate that information. And we do that a lot because there's good reason for people to be skeptical about, hey, I'm putting AI in here. What was the story the other day? Like an AI went in and deleted somebody's entire business databases in like what, 9 seconds or something. And then, yeah, yeah, it said, I broke every rule. Yeah. Yeah. Nice. I wish I could give you that information, but I'll chase it down if you'd like me to do that. Yeah. But, but the not GA yet? No. Yeah. Okay. Good. Good. But, yeah. So the intent is for it to be downloaded, but it looks okay. So it's not out yet. Yep. Thank you. Um, but again, the bulk of this is really to tie the picture together to say, hey, we want to facilitate a better healthcare experience for everyone. And if you've been in the US for a while, you know that healthcare is complicated, put it that way, right? So being able to facilitate a better story, a better picture to make lives easier to a certain degree, patient care easier, um, save on physician and nurse and radiology, frontline worker burnout. That's really the picture that they're trying to paint here. Okay. Um, Now we kind of already touched on a lot of this stuff. Yeah, the big deal is really thinking about who it serves. So again, physicians, nurses, and radiologists, they have their own separate kind of workflows, but that the Dragon Copilot facilitates all that. Dragon Copilot was out March of last year, and then the nurse component and radiology was right after later in the year. So they're still kind of new-ish, but the workflows on nurses has been apparently very well regarded. Um, the other thing to pay attention to here is coding. The one thing that Dragon Copilot will do, if you're familiar with insurance coding, ultimately is the shorthand version. So you know, you go in for something, right? You're gonna have an appendectomy. I don't know why that came to mind. It did. You got your thing. There's a whole list of codes that they will put together to send over to insurance and said, here are all the things that were needed, right? Those are mistaken all the time. And as often as any patient might feel like they sit on their phone and talk to their insurance provider to try and get paid or try and get something covered and all that stuff. Um, Healthcare facilities are doing that with the insurance as well. Like they spend a lot of time on the phone trying to get paid from the insurance providers, right, from the various carriers. So one of the things Dragon Copilot will do is um, pick up on the way that a conversation is going and the things that are actually recommended as far as treatments and the way that things are put together concerned, and be able to make suggestions around the codes that actually go through with that. Ultimately, that comes down to it's called revenue cycle management, right? And that is really just making sure that we are getting paid on a regular basis or a predictable basis, and with a minimal amount of effort put behind it. Right. So just having that built in can save a ton of time. And then there's this App Store component, which is not like the App Store that I was talking about right a second ago. But there is a Dragon Copilot App Store that is supposed to have all these facilities built into it. That one I haven't seen yet. I've just kind of read about it. That's what I don't know. It it sounds interesting, but yeah, a lot of the App Store stuff I haven't actually seen yet. Right? Sure. That's the one that I am aware of is for healthcare. It it's so it's not about it's more about the behaviors. Yeah. Mhm. Right. Right. So that so the BAA is the foundation of that. It's what's saying, hey, here are the things that you are accountable for. Like to your point, you're going to configure all this stuff to work in your environment. If you do not configure those things and something goes wrong, right? Microsoft hands off. It's a liability waiver as much as anything else. And it's their line. Like you can't go through and redline this thing. They're putting that forward to say this is how it's going to go. Um, and but they do talk about usage, right? The usage of different applications and the way that they leverage the information, and that's where like they'll talk about what data they can use to train models and what they don't, right? So you go right, yeah, yeah. Well, and most organizations will sit down and talk through, and we'll put down an AI use policy, right? Um, so while we have talked about this, I haven't deployed Dragon Copilot in any uh, organization yet, right? Um, so they're aware, but it's really new, and everybody's trying to step into this AI space. It's the same thing that we were talking about earlier, where um, everybody's adopting AI to try and do something with it. Nobody knows what to do with it. They'll come up with a use case to build a thing. They try the thing. Okay, that's great. It sits on the shelf, or maybe it like saves a little bit of time somewhere, and then they put that into play. But it gets really expensive if you're using it and you're not doing anything. So that's really where the big challenge is. And I mean, anybody that's looking ahead knows that, as is typical, they're going to get you kind of hooked into this. Then they're going to raise the prices on the licensing, right, to make sure that they're getting their money back, because all those organizations today are just kind of not, well, they're not making a lot of money. We'll put it that way. But I remind it. I'll have to come back to it. This piece is really cool. So Microsoft AI is diagnostic orchestrator. So we'll just call it DXO. So this tool is actually meant to be able to facilitate diagnosis of patient issues. Okay. They have done so with an 85.5% success rate on a series of cases, as compared to 21 physicians who were at a 20% rate. Okay. Well, let's talk about what that means for a second, though, because those numbers sound fantastic and you will hear them elsewhere if you talk to anybody at Microsoft. But um, these 21 physicians, they didn't sit at a table and collaborate, right? They got the cases. These were all very, I want to say rare cases, but rare. They weren't super common. Um, but they didn't collaborate. They didn't have documentation and materials available to them. It was, it's kind of like taking a test. Sit down, go through the cases. Your hit rate is what your hit rate is. That is not exemplary of what doctors do when they're working, right? They sit down and they talk to one another, work on, challenging what the actual diagnostic or what the diagnosis is, where the bias might sit. Are we missing things? That sort of business, right? What Microsoft did with DxO is actually take AI and do that. So they are leveraging every one of these models and to a certain extent, I want to say pitting them against each other, but kind of, right? So somebody's like one of those is responsible for the actual managing of the diagnosis. One of them is responsible for challenging the diagnosis. One of them is responsible for uncovering bias. One of them is responsible for making sure that the system is even working the way that it does, right? So it is kind of a unique approach of saying, hey, you know what, let's just not tie into one model. Let's leverage these models to kind of challenge each other the same way that a doctor would, right? So you're giving them the same information. They're going to learn and operate differently, and they're able to challenge each other to the point where we're hitting at a success rate of 85.5%, at least at those initial studies, right? Still in progress, right? No FDA clearance. You can't go diagnose somebody with this today. I mean, I suppose you could, but not without getting in a lot of trouble. And then, trials are roadmapped, but all that's going to be dependent upon, one, if there's any legislation around it, and then two, kind of the compliance models behind it. Yeah. Yeah. Mhm. Good topic. Yeah. Sure. Oh, good question. And fair enough. Like I was saying earlier, it kind of changed the positioning after we went through all the announcements and stuff in March. However, Teams still remains that core communications platform, right? So all the components that we're dealing with here, when we're dealing with healthcare organizations that are on Teams, they're in two things: they're in Epic and they're in Teams, right? And so they are operating all their communications in this part of the platform from a Teams perspective. Uh, any of the things that Microsoft is talking about doing, let's say leveraging Dragon Copilot and all those components, we'll be pulling context from those conversations where it fits, right? So Microsoft 365 Copilot does that today. Dragon Copilot, in the case where you have consultative meetings, right, is going to be places where they actually pull that in and let that be pushed into the physician's notes or the nursing notes and those components. The Teams just still remains kind of that centralized platform. I wouldn't say that there's anything specifically new about what's happening on Teams from that perspective, but just really the kind of the reach of what they're doing with it. Sure. I'd accept that. Yeah. I need you to make me another slide. Yeah. Yeah. No, yeah, it's very valid. So when we're going through this and actually putting it together, like there really isn't a lot of team specific stuff that's changing, right? But I did want to focus on making sure that hey, there are some really new things that are happening, and that everybody kind of understands those. Stakeholders, right? You can talk about any of this stuff and where it actually kind of makes a difference. We've touched on all this just at least a little bit, but the conversations that you have with physicians really, hey, you get to use your EHR. We're going to make documentation a little bit easier. You're going to save a ton of time throughout the day, right? So you don't have to let your patients sit in the off or in the patient room for too long while you're filling out your documents, or you're spending the rest of your day doing it, or burning out lunch. Same is very much true for nurses. Their documentation is a lot more specific. So being able to have those forms basically pre-filled out just based off of the conversational context around it. And then scheduling via natural language is nice. It's nice, especially if you have somebody that's not tremendously computer savvy. IT and compliance conversations, everything that we've been talking about since the beginning, right? So going back to that BAA, purview, zero trust, it's going to be a shift in the way that they're being attentive to stuff. I think we've all recognized that. I mean, we're talking about it from the keynote perspective, right? The UC world, like we have all morphed out of the UC world into this like AI compliance thing that we all have to pay attention to. CFO, right? The person that's going to want to make sure that we're making money. The coding component and accuracy is a real big deal because that actually points back to that revenue management, right? So making sure that we're getting paid, making sure that it makes sense. And then the licensing component is the conversation that we're having today. And we'll see what that looks like after July, right? If that shifts greatly. And then the patient thing, I am interested in seeing some of the Copilot Health stuff and how that actually starts to roll out. That'll be a cultural shift as well. The other thing that I guess I haven't brought up yet, but is kind of nifty in the way that Microsoft's rolling this out. Rural healthcare, if you're not familiar with, is suffering greatly, right? It's hard to keep those facilities up and running. People who live in rural areas are having to travel further and further and further to get the kind of care that they need, or to even just get the consultation they need. The government last year, I mean, currently there's $50 billion being invested into rural healthcare. Was that rural juror? Anyway, it's a 30 Rock joke. So they're investing $50 billion into healthcare facilities that have been deemed to be rural. There's a discount on the licensing for Dragon Copilot for all of those facilities. But if you're actually looking at it from hey, we have some of those facilities or have some of those systems that could really benefit from some of this, is a really great stepping stone to get there. And if you can leverage the way that the government's putting some of the funding into those organizations, that you could realize that as well. Ultimately, you could actually impact a lot of these customers without having to charge them a lot of money, which is always a great feeling for your customers. Cool. Think of this more of, kind of customer facing, but really, how are you addressing your customers, right? Making sure the foundation is right. Are you going down? Your organization's moving heavily into teams and leveraging the tools that we're talking about today. BAA, check your compliance. What are you doing with MFA? Set up all your policies. That happens relatively quickly, right? Like you can actually work through that in some small amount of time. Maybe rephrase that. You can work through that in a small-ish amount of time to actually start to identify. But again, the conversation needs to be around what those outcomes and what those workflows need to look like. It's the discovery access, the discovery aspect takes a lot of time. Saving money, checking out licensing. It gets really hard in 2 months' time to have somebody go back and talk to Microsoft and say, hey, your licensing is going to change, and I want you to review your entire model and actually get it out the door and shift your budgets in the next 2 months. That'll be a problem. But if you're not having that conversation, you're making a mistake. And then looking at what they're going to do with compliance as it applies to um, frontline workers and that E3 component. Okay. And then AI, right? Sorry, I said it again, and it's a thing. But uh, what is that going to start to look like for the organizations that you're working with, right? There are very good cases for the stuff that Microsoft is putting together for driving down personal human effort, being a lot more efficient and effective, the rural outreach, leveraging existing environments. I mean, we talk about it from a phone perspective all the time, but tying into existing EHRs, and then being able to move that stuff forward and really optimize what your patient experience looks like. All right. Open for questions. Hope I have answers. May not. From this guy. All right. So this is Brian. Brian works at Continue as well. He's one of our premier sales engineers. So I hope this is a softball. Now, yeah, good. Cool. All right. That's I'll set you free 10 minutes early. Appreciate you guys coming in. I'm around for a little bit for questions. Thanks to the Comms Next team for having us out and talking. We'll see you guys around.